I think the one word that would sum up for me the ACC Patient Navigator program, that would be progress.
Our Navigator has really been a great step route or a reach out to the inpatient services. Now we've got continuity going from the hospital to the outpatient clinic.
Having the ACC Patient Navigator program here, it has allowed us to help these patients transition from the inpatient to outpatient and have everything they need in order to be successful.
The ACC Patient Navigator program is a wonderful opportunity that was afforded us through AstraZeneca, who provided the funds to allow the American College of Cardiology to offer 35 hospitals the resources to be able to provide someone to navigate the patient from inpatient to outpatient for a successful transition to be able to manage their symptoms at home and meet their goals.
I've been involved with Miss Alabama, Miss America program for 45 years. 2005, I was at work and I'd had a heart attack and they did a stent and I stayed 3 days.
So I was consulted on him in the hospital and went to go see him, and he was laying in bed and not too happy he was in the hospital, and he had just had a surgery. And he said, every time I have a surgery, I end up back in here a few weeks later and I never understand why.
They came in and wanted to know all about me and everything and asked me would I be interested. And I said, of course I will. Anything to make me feel better.
To ask me how our patients have been impacted is probably the thing that makes me the happiest. I can recall several times a patient actually hugging me and saying, "Oh my gosh, thank you so much for just taking the time to explain that to me."
They came in, looked at my medicine, told me what to expect, and things I didn't know and hadn't been taught before. And so that meant a lot to me.
Patient education is important because that's what gives them the ability to care for themselves and know what to do in order to keep themselves out of the hospital.
It's just keeping the patients out of the hospital. That's the main goal.
We're so grateful to AstraZeneca and the American College of Cardiology. We would not have had the resources to fund a staff position in order to reach out to these other centers, in order to improve our 7-day follow-ups.
One thing nice about working for AstraZeneca is we follow the science and we put patients first. And that's exactly what you see at Huntsville Hospital, because they put patients first as well. They have the heart of the patient at mind, and I think that's very important for the program.
For the healthcare system, it has helped us create a new environment so that we can progress through the changes that are developing in the healthcare system. And for the patient, it helps them progress through a disease process that sometimes is very new to them and create an ability for them to be able to be successful at home in managing their symptoms.
We could not have done this without this program in place, and we're awfully grateful for it.